Warm welcome, everyone. Today is the 12th of April, 2022, and it's our 11th experience sharing session for the exercise on situation analysis of the full learning cycle. And we are here is because we are part of the movement for immunization agenda 2030. And concerning the situation analysis, if you can see from the timeline on the screen, we are actually in week 4. And week 4 is the most important week for this exercise. Why? Because you have one goal, which is to revise and improve your situation analysis and submit the final version before the deadline, which is Friday, 15 April, before 11:59 p.m. Geneva time. And before that, by tomorrow, you are going to be receiving a link in your mail inviting you to submit your situation analysis with a series of questions that you have to answer before that. But how do you revise and improve upon your situation analysis? What do you need to do? First and foremost, you need to go back to Peergrade to read and react to all the feedback that you receive from peers concerning your situation analysis. And even if you receive just one review or two reviews because some peers did not meet up to their engagement for peer reviews, don't worry. One thing you were able to do last week was you were able to review the works of 3 peers, and I'm sure you learned something in the process. So use what you learned as well as the feedback that you've received from the 1 or 2 peers, and use those to improve upon your situation analysis. And also remember all of the resources, all of the feedback that you've received from François throughout our experience sharing sessions, and see how you can take advantage of all of this feedback, all of the comments, all of the advice, the counsel, to improve considerably your situation analysis and be ready to submit the final version. While you're doing so, ask yourself this question: how can I improve this situation analysis so that it actually helps me to tackle your challenge? So remember, situation analysis is not just a pedagogic exercise, but it's actually helping you to understand your problem, your challenge, and what you need to do to tackle it. So always have that in mind, even while you are revising and improving upon the situation analysis. So there are some useful resources, some video that Reda has prepared to help you understand what you need to do this week, as well as how to receive feedback and react to feedback from peers. And I'm just sharing the links with you in the chat. If you have not yet watched this, make sure you watch them before the end of the week, before submitting the final version of your situation analysis. That said, I'd like to invite you right now, if you want to share your experience of situation analysis, go ahead and raise your hand, and I'll be delighted to invite you to unmute yourself so that you can answer the questions that are on the screen. Meanwhile, I'm going to turn towards Dr. François Gasse for his 2 pieces of advice, 2 counsels, important counsels that you like to give, share with scholars who will be revising their situation analysis this week. Over to you, François, and warm welcome.
Merci, Charlotte, and hello to everyone today present in that session. So I think let's be clear in few words. Your situation analysis was starting from, I have an objective to reach let's say 80% coverage or 85% in my district. I've not reached it, and to make a progress towards that objective, I have several challenges, and I've chosen this challenge. And this is a challenge that you are putting here that you want to overcome. The challenge has to be very specific based on, I'm sure in your district or your region, you have many challenges, but one may be one that carry a weight, and there is some numbers about it. One example, a dropout could be 20, 15%, and you consider that addressing this challenge will help you to increase your coverage in your area. Now, of course, you're starting from 15%, and your aim is to go to less than 10%, for example, over a period of months. Now, to address that challenge, you need to understand what are the causes, for example, again, of the dropout. And this requires sometimes some activities, some informants interviews to understand what are the main cause and to dig in the cause to find the root cause of the dropout, for example. Then if you go and you dig enough, you will have finally an idea on how you go to correct the situation in the next step of this exercise, which is implementing the idea you have or you have found in some of the idea engine to improve the situation of your dropout, or it could be any other things. This is the aim of this exercise. Your reference could be surveys, could be visit of some communities, could be visit of some health center, reviewing data, the reported data, survey data, that helps you to really make a very proper situation analysis. And don't hesitate to be data-driven when you explain your challenge and the cause of your challenge. It will be easier for you to convince your superior, your supervisor, that this is worth doing the work as an effort. Thank you, and over to you, Charlotte.
Okay, thank you very much, François. So I'm inviting everyone in the room, please raise your hand if you want to share your situation analysis with colleagues today. And even if you're unable to share your screen, it's okay. We are going to listen, and you'll be answering the questions that are on the screen. And I know most of you actually worked on, you already submitted the initial version of your situation analysis. You did peer review last week, and we have received comments from peers concerning your own situation analysis. What have you done with the feedback that you have received? How has it helped you, or how is it helping you to improve upon your situation analysis? So, and what have you learned? What have you learned throughout this process? Please go ahead and raise your hand if you want to speak. Okay, I see Mike Suka. Mike Suka, you've unmuted yourself. Mike Suka, was it?
Yeah. Hello, Charlotte.
Yeah, hi.
Yeah, hi. Thank you for the floor. You know, it was I was a little bit mistaken. I needed to do something else, but no problem. Let me contribute.
Okay. Are you able to share your screen?
No, you can do it for me.
All right. Okay. So please go ahead and remind us who you are and where you work while I am accessing Peergrade.
Yeah. Thanks a lot. You know, first I made a confusion. I spoke about another thing instead of speaking about immunization. And after that, about peer reviews, free peer reviews, I did it well, but I didn't respect the rubric. And after the feedback has been sent to me, and I understood, because I was mistaken, I understood that I have to care about the rubric. And when I did it, I understood it perfectly and I correct. No, this is the first. Okay, you made a confusion. Yes, I was. And the last, yes, this one. Yes, I understood after the feedback, and I said that feedback was important for me. I understood so many things I didn't do before, and the situation analysis helps me to discover or observing things which is going on, not going in my surroundings, so as to find solution to these problems. But right now, I have another way. I'm seeing the world in another way, observing so as to find solution to problems. And it was a good experience for me, even if it was a little bit stressful and not difficult, but complicated. And I did my best. Thank you for this opportunity. If there is a question.
Okay, thank you very much, Mike Suka. But before you mute yourself, can you right now, based on what you learned from the peer review, can you just share with us what challenge will you be facing? You know, what is the challenge that you're facing, and what is your situation? Just a brief summary of your situation, so that we can understand.
Okay, thanks a lot. I am focused. I mean, I was focused on homeless children. I mean, kids streets. You know, these are children who live on the streets in public places, okay, without support. They feed themselves, they manage themselves. They do all on the streets without support. They don't have access to healthy food. They clad on, unclean clothes. And I was focused on them because they are not vaccinated, they are unvaccinated. And here, where I'm living, this town in Kinshasa, there is a place we call Échangeur. It's located in Limete Township. We saw so many homeless children there. And I went to talk with them. In the beginning, it was a little bit difficult because they refused. They say, no, you know, people are saying that it's for killing, it will be a bad thing for us. And I told them that you are really mistaken. You don't have the good information. Let me advise you a little bit. You know, you're living on the streets, you are exposed to so many diseases. I mean, so many problems, so many matters. You know, if you are unvaccinated, it will be very bad. You can even pass away or you can die. And they understood. Last time when I was passing by there, I saw Médecins Sans Frontières, Médecins Without Borders. I don't know if I'm mistaken, and talking to them and giving them vaccine. They've got vaccine, and it was my pleasure. Thank you.
Okay, thank you very much, Mike Suka, for sharing this with us. And before we move forward, I'll actually, François, this is a case that is not very common, that is focusing immunization on street children, homeless children. Any comments on this? But I see there are actually two raised hands. There is Stephen Bana, Yusuf Abdullahi Siat. Maybe I should listen to both of you before I turn towards François.
Yes,
Stephen, please go ahead and unmute yourself. Hello, Stephen. Unfortunately.
Hello.
Yes, Stephen, please go ahead. Yes.
Yes,
we are not able to hear you. Unfortunately, Stephen is having connectivity issues. So, Melese, I see you've gone ahead and unmuted yourself. Please go ahead. And it is to comment on Mike Suka's situation.
Okay, thank you. It's really very important to just assess our situation that help to develop contextualized strategy to mitigate problems that's already available in the program. So during my situational analysis, I try to see different informations in different areas. There is something. Yeah, there was actually a disturbance. Can you hear me, Charlotte?
Yes, we can hear you, Melese, but I want you to remember I said we are commenting on Mike Suka's situation analysis, not you sharing your own. Please, for now.
Yeah, actually, I'm not actually good to understand what he exactly present in his situational analysis, but for me to just say something, when we are analyzing our situation, we need to use different source of information, researches, reports, and actual situations in the health facility level is very important. So we need to have aggregate information so that to be concrete, even to develop our action plans. Otherwise, there may be actually misleading if we use some just a bit information or a fraction of information, or just that is not really shows the actual context. It's really difficult to develop a good action plan finally. So we need to have aggregate information. That's information in different sources, maybe national reports, government reports, non-governmental reports, and published reports even, and also direct visiting the situation is very important when we just try to assess our situation. So this is my comment. Maybe it's a general comment actually.
Yeah, thank you, Melese, for that comment, which is very helpful and useful. So I want to invite Burema Kabore. Burema, over to you.
Hello, thank you, Charlotte. Thank you, everyone. I'm Burema Kabore, and I'm from Ouagadougou in Burkina Faso. Okay, thank you very much. My situation is that due to lack of security, most of health facilities are locked. Yeah.
I'm sorry to interrupt you, Burema, but I'm sure we'll come back to you later for your situation. Let me just turn towards François Gasse for his comment concerning Mike Suka's situation, and then we'll move forward from there. Over to you, François.
Thank you, Charlotte, and thank you, Mike. I think, Mike, you mentioned street children, and you gave a lot of information on those street children. My first question is that, you know, street children, they are not in the street, or they are with their mother when they are less than one. That's my first question. Or you consider it in the context of a measles rubella campaign or OPV campaign. Can you be more specific? Why do you miss those children less than 5 who are in the street, playing in the street, and not reachable? Because street children is a very important issue in the campaign for polio or measles. Was it the case in your case?
And I'm asking Mike to unmute. I'm giving Mike the.
Yeah.
Okay, Mike, you're unmuted.
Yeah. I understood. And I emphasize, I gave also the responsibility to the states, I mean the Ministry of Health, because it's also their responsibility. Those children are identifiable. People, when we're passing, we are seeing them all over the country, all over the town. They are easily identifiable to come to talk to them, to even write their name down, register, register, and to help them having vaccine, because they live on the streets. They didn't come in this world by themselves. No, we know today. I can give a simple example. If they are killed by someone on the streets, that one will be arrested. It means these are very important persons. They're also useful for the society, and the governments must do something for them.
No, Mike, if I can rectify, of course, we are in an immunization movement.
Yes.
Now, the focus of immunization is either reaching the children below 1 routinely, or reaching the target for COVID, or reaching the target for measles campaign or polio campaign. They have to be reached. And those street children, I'm sure, represent a challenge, not only for immunization, but for many other issues where you may be in charge. Now, here, our part is from the movement for immunization, the Agenda 2030. So if those children in the street are less than 5 and you try to reach them, that's a nice challenge. And it would be good to say, when we do a campaign, we missed 20% of the kids, for example, and we know that among the kids missed, a large group are street children. And then you can go on and try to find the cause and the solution. And if you need information, you can dig get a local study to understand how can you reach them. As you say, do they belong to some communities? Do the mother on the market, but bring the kids because they have nobody at home to look after them? I think you can get through observation and interviews a lot of the mothers of those kids in certain area, a lot of information, and the local leaders. But be careful on not just identified street children, without being very specific on why you need to identify those children. And here we are in the immunization agenda 2030. We are not in the other social issues that may affect other elements than immunization.
Okay, thank you very much, François.
Thank you.
And thank you so much, Mike Suka. We have to move forward, but before we listen to another experience, and I'll be turning towards Burema Kabore because I interrupted him earlier on, I'd like to turn towards Reda, who is with us in the room to introduce our lead researcher of the Geneva Learning Foundation, because we are going to have an exceptional experience sharing session on Thursday, and Ian Jones and Reda are here to talk a little bit more about that. So I'll first of all start with Reda and then Ian Jones.
Greetings, everyone. Great to see, always good to see, to listen into these experience sharing sessions. Thank you, François and Charlotte. Indeed, on Thursday, at the time for the experience sharing, so at noon Geneva, on Thursday, the 14th of April, you will be, some of you have received an invitation, but anyone who is actively participating in the experience sharing is, of course, welcome to join. And the purpose, I just put it into the chat. I'm going to let Ian Jones introduce himself, what he does in the foundation's team, and basically explain what the point is, what he will be working on, what experience he's interested in on Thursday, and where that will what the point is for Thursday's special focus. Over to you, Ian.
Thank you very much, Reda, and hello to everybody. It's been a great privilege to be able to tune into this session and into a few past sessions. So I'm an associate of the Geneva Learning Foundation, and I've been involved in the development of the Immunization Agenda 2030 at the global level. And I'm now carrying out some research and some activities with the foundation, and we have a particular interest in the issue of zero-dose communities and under-immunized communities. Lots of people very kindly submitted information when in their application to join the Immunization Agenda movement. And what we're hoping to do is send out another mini survey, very much shorter than the original one, but just to capture a bit more information about the kind of zero-dose challenges that people are facing, how they've gone about understanding them, and the kind of plans they're putting in place to address them. That will be unveiled on Thursday, and the survey will be going out to a selection of participants, and we hope to get from that a bit more detail about the kind of activities you're planning or have carried out, and we hope to feed that through to people who are working at the global level so they can get a much better sense of what's really happening, what are the real challenges for people who are working at the front line. So I'll stop there, Reda, and hand you back to you so you can carry on the discussions, and hopefully hear from you all again on Thursday, which should be a very interesting session. Thank you.
And yes,
okay,
thank you. Thank you, Syed, for pointing out that it is the 14th. I mistakenly put the 12th, so let me just correct that just to avoid confusion. It's not today's session, obviously. It's Thursday, the 14th. Thank you very much, Syed. Back to you, Charlotte.
Okay, thank you so much, Ian, and thank you, Reda. I can't share back my screen because unfortunately Zoom is frozen on my computer, but I think I can turn towards those whose hands were raised. I just noticed that unfortunately we have lost Burema Kabore, probably issues with connectivity. But we have two raised hands. I want to invite Yusuf Abdullahi Siat. Yusuf Abdullahi Siat, please go ahead and unmute yourself to share your situation analysis with us. Yusuf, I hope you're able to hear me. If not, we are going to
Hello.
Yes, Yusuf. Yeah.
I'm Yusuf Abdullahi from Kenya, health worker about working in the immunization department. I would like to share my situation analysis based on the low uptake of the pentavalent vaccines. We realize that there are a lot of low uptakes of the pentavalent vaccines, especially in the rural setup, because I work in a rural facility. And we were unable to understand what was the root cause of maybe the community not coming to, to come and access the eligible vaccines that are available in the facility. So we came to realize that based on our situation analysis, that's identifying the root cause as a problem of not coming to the facility and accessing the vaccine. We try to sit down with the community, with the, the champions and the local persons of the community. And we know that the problem was some of the community were not aware of the importance of, getting or bringing those children to the facility. So we try to empower them through community volunteers. We created a forum for them. We did a capacity building for them. We trained so many volunteers who are the representative of that community. And then after that, we do networking and collaboration at the community level. We teach them the importance, and from that analysis, they realize the importance, and they come to the facility. They get linked to the facility, and we were able to get to increase the coverage. We carry out several, outreaches. We carry out, contact tracing, and the uptake was a little bit, increase, and the target we're having, I think, will continue from there. Yes. Hello.
Okay, thank you so much. Thank you so much, Yusuf, for sharing that. And listening to you, it's as though you have already figured out everything that you need to do as far as your situation, the challenge you are facing is concerned, and you're already. But can you just share a little with us in terms of the numbers? Because remember, François Gasse keeps telling us it's important that everything you say has to be data supported, data guided. So in terms of the coverage, what was your coverage initially? Where are you? How many points have you gained in terms of coverage right now? So
the coverage, we were having around 50%. But now, after we carry out the analysis and we identify the problem and we engage the community, through the community volunteers and the local persons, we have increased the percentage to 65%. Yes.
Okay.
So currently we're having 65% coverage. And the challenges, you understand, one of the challenges we identified is that, rural community, for them to accept that this is, the importance of getting this vaccine itself is a challenge. Another thing is, accessibility in terms of, most of the rural community, they are living with the poverty line. Even transport itself is a challenge. Also, the availability of the vaccines also sometimes be a challenge because of the that rural setup itself. Yes, but as means, what we are trying our level best to overcome those challenge and to overcome that the zero dose itself. Yes, and we want to reach everybody, every child, to get that eligibility of that vaccines. Yes.
A little, Charlotte, may I ask a little question?
Yes.
Yes, François, please go ahead.
Yeah, you say 50% coverage, but you talking about Penta 3 or you talking about Penta 1? What is your Penta 1? I suppose you talk about Penta 3 when you say 50 and you moved it up to 65%. What's your Penta 1, which is an indicator of access?
It was Penta 1, which was 50%. Yes, because Penta 1 is the determinant of all when it comes to the vaccines. Yes.
And what is your Penta 3?
My Penta 3, it was around 40%, but now it has increased to 50%.
Okay, I think it's interesting, your situation analysis. You have started and you're doing a beginning of a situation analysis, but you imagine that the people that have not been reached by Penta 1 in your rural health center are the zero dose. Now, zero dose have many reasons to be zero dose. And I think you have addressed one reason, which was to try to make sure that when the vaccine session is there, people use it, and you have reduced the dropout, which is good. Now,
Yes.
I would like to understand in your analysis situation, the 50% that don't receive Penta 1, is it an accessibility issue as you have started raising? And you need to document the accessibility of those population. Accessibility means 6 contacts at least a year through an outreach. And so it's a combination of, I think your utilization is quite good. You've reduced, almost eliminated, according to your figures, the dropout, which means people return. When you catch them once, they return. Problem is the one you don't catch. And is it, you need to dig in it in your situation analysis to find, is it an outreach? Are you doing outreach or not? Are they frequent enough? Are people informed? And what is the quality of those outreach? Otherwise, if there's an accessibility you don't address, you don't expect population to move many, many kilometers and the cost of it to do vaccination that may not be a priority for them. So I think it would be good to document more the cause as, is it an accessibility issue? Is it an utilization issue, or is it both?
I think, it can be, most of, when it comes to the accessibility, it is the health facility, accessible to the community. Yeah, the health facility is accessible, but now the challenge is that, this is a rural setup. Most of the community, they migrate. And then what we can do is, despite they migrate, they move from one place to another, we do outreaches so that we make sure that that vaccines, must get all the required children who are eligible to get that vaccines. Yes.
Okay, so I think, your activity is very important to document all those elements. This is a situation analysis to identify the main cause. What is among all the problems you face, what is the main cause? And you may face many, if they move, reaching a migrating population is not easy. They may be one place and another place, you need to have information. So you need to have an information that tells you really, is it an access issue that we have not solved? Or is it an utilization issue that we offer the vaccine, they are within reach of this population, but they don't come because maybe they are, and why they don't come? Is it not a priority? Do you need a special strategy to make sure they all come? So I think digging in your situation analysis, where you are at 50%, which is relatively low, with a low number of zero dose, a high number of zeros is very important. So you need to, your situation analysis should go a little bit further. You are starting addressing utilization, but make sure you analyze this far more the accessibility issue.
Thank you. Okay.
Okay, thank you, François, and thank you, Yusuf. There was a comment in the chat from Omar Farouk that says, even if they're a mobile population, they must be covered by that area's outreach team. And I see Jaurès says, notice also that the devil is in the details. Penta 170 probably in some areas, that is that maybe if Penta 1 even is at 65 or 70, in some areas it will be below 50. And maybe one thing I also wanted to ask François, what about the importance of maybe doing a mapping? If those mobile populations, when they migrate, are they all in the same place, or do you have different zones? Having an idea on the number of the target population, number of children that needs to be reached in each of those areas that they migrate to is also very important. Just to add to the comment of Jaurès in the chat. Okay, and I see Omar Farouk talks about the importance of, I don't know, Omar, you're putting comments, maybe I'll just like to invite you to go ahead and unmute yourself. Omar Farouk, are you able to unmute so that you share your thoughts with Yusuf? I hope you're able to. I'm asking you to unmute because you're raising. Okay, probably Omar Farouk is not able to speak. So that said, I see we are 6 minutes above the 30-minute mark for the session, but I know we took some minutes to talk about, to invite you all for the special session on Thursday. So I think, François, can we listen to one last experience before we separate?
Yes,
okay, so I noticed that Burema Kabore was able to join us. We lost him again. So we are going to try to see if Stephen Banner, you're able to unmute yourself this time around, and that your connectivity will allow you to share your situation with us. Okay, Stephen, over to you.
Hello. Hello.
Yes, hi, please go ahead.
Hello.
Yes, please go ahead.
Yes,
Stephen, I can hear you.
Yeah, I'm Banner Stephen. I work in the Upper West region of Ghana. My challenge has to do with a problem of a structure where we, the immunization staff, together with our clients, will sit. When I was posted here, I realized there was no such a space. So we're using the ANC block where we share a space with them. But even with that, we're not having a table or chairs to put our books on. There's nothing at all like that. And so we're only giving a space behind. There's a bench where we put on our vaccine carrier and all the other equipment and logistics that we need to do our work. The same place is where the ANC staff also attend to the pregnant women who come for the ANC services. And so there's a competition for space when it happens that way. Most of the time, the pregnant women come in their numbers. And so it became a challenge for us. This same place, the hospital itself is not having a conference room. So there are times when trainings and workshops, activities are going on. They use the same ANC block. So when it happened that way, the ANC staff, together with the immunization staff and our clients, we have to move out until it is all over before they give us we can get access to the room for our activities. So as time goes on, I notice a decline in the attendance of our services, which when I spoke to some others, and sometimes when they come and then the ongoing activity in the place, they have some of them. When they go home, their husbands will complain So it became an issue for them. That's why there were no more coming. So that is my challenge. We have brought this challenge to the attention of the hospital management, and they are going to build a shed for us to be using for our immunization services. But almost every year we keep reminding them, and up to now, nothing has been done about it. So this is my challenge, and that is what I'm working on for my situation analysis.
Thank you very much, Stephen Bana. And I was just sharing, because you have quite a peculiar challenge. I was just trying to share your situation analysis in the screen on Peergrade. So I'm also inviting colleagues that are in the room. If you have any thoughts concerning the situation analysis, go ahead and share your comments in the chat. Now, Stephen, before I turn towards François, I wanted to find out from you the feedback that you received from colleagues for your situation analysis. Did you find that? How did that help you to improve upon what you have already done?
Yes, so far, all the comments that I received, most of them were encouraging me of what I've is on point. And there was one that me to use some inkling. The matter to come for
Unfortunately, I don't know if it's my connectivity or it's yours, but I'm not able to hear. I'm not able to hear Stephen.
It seems the network.
Okay, so sorry, Stephen, but I think we got the essential of your situation analysis, and I also saw that, as you were saying, you got very useful feedback from the peers that reviewed your work. François?
I think it's a very good situation analysis. Of course, we are in a country that's very well performing, and the quality of service offered becomes an important issue because there is accessibility, but the demotivation when the local space is not proper for women in antenatal care or immunization. And what I was wondering is, what are the, what's your real challenge now? Because it seems that you have addressed the challenge, you have requested for things, but things are not coming. That means there is no response from the supervisors to address your request for the modification, or there's no follow-up, or what is the real problem in the solution that you found?
Yeah, so Stephen, let's try again. I hope you'll be able to unmute yourself to answer. Over to you. Probably I'll also turn towards your next steps that we'll see. Stephen, are you able to speak? Please go ahead.
Yes, please. So I think the issue has to do with, we are in a community, let me say, it's the community is like a poor urban community. And so coming by resources is very difficult. The community members, they are committed to, supporting, but sometimes it's not easy. And then the MP, the member of parliament for the area, also has been supporting, and the district assembly as well. But this challenge has to do with, I don't know, mostly the hospital has a challenge with the disbursements of funds when it comes to the health insurance. And so it becomes very difficult when they want to undertake a project or something that involves money. when the health insurance money is not coming, then it becomes another issue. And the hospital itself also lack a basic logistics, and all has to do with money. So when it comes that way, when we tell them about our challenge, you can see they are willing, but it's the money issue that is the challenge.
So I think thank you, because you coming to a new issue. You have resolved, you have found what would make better the accommodation of antenatal care and immunization. Now your challenge is to be able to implement, and there is a resource constraint from the hospital. And what do you plan to do to address this resource constraint? Because that could be your next step. It will be to have an action plan to ensure that the funds you need to have this solution implemented takes place.
Stephen?
Hello.
Yes, we are trying to hear you, but unfortunately we can't. So Stephen, please, I'd like to appeal. Can you answer François' question in the chat? Meanwhile, I'll be inviting from Daniel, Kwesi Ekwam, whose hand is raised. I'm sure from Daniel may have some comments for Stephen about the situation and maybe possibly solutions. From Daniel, over to you.
All right, thank you very much, Charlotte. I personally know Stephen. I know the hospital he's talking about. I have worked in that hospital for over 12 years, and also in that particular district. So I know what he's talking about. But as I could see that he has, looking at the challenge he has given, it tells you that he knows he has already even done a situational analysis and know the root cause of his dropout or low rate of immunization. So what I was expecting, I'm expecting him to do is that with all the various coverages of immunization, he should look at it from the very time they started their public health unit. You should look at the coverage at that time out. It is just a various immunizations at the baseline survey that they have, the baseline result they were having. What is it currently? Then it will really give an indication.
We can't hear you, Farm.
But the office is used, or the structure is a multi-purpose. When he's able to bring out all these coverages for us to know that indeed, looking at the period where they started, where they have the baseline and where they are now, and at this data, once you have this data, there's a district director in that district who is very much interested. It's one of their key areas for their appraisers, immunization coverage. So I think if he's able to have such a data, read data that shows with evidence, he can approach the district director and let him also know, because the hospital is under the district director, because it's what jurisdiction. So if he's able to get in touch with her, give her the data. I have worked with that woman before. She is very proactive and is somebody who can mobilize funds strongly. She can just make a phone call with the data she has. She can really mobilize funds, and that structure could be built. So I believe that is the data, bring out the data as evidence so that you can meet even the management of the facility that, oh, management, this is the reasons why I'm saying it. It's not just that, oh, that is where we need to work and we are using it for multi-purpose. What are the effects? what are the impact that is coming? What are the statistics? It will even show you the numbers that are dwindling. And they will know from your statistics that you have with the health information, so that when you share this with them, especially with the management team and also with the district director, I believe if really you have a strong evidence backed by data, is good to go. And if it comes to the point he has that data and even calls on me, I can even help him to get in touch with the district director if he's finding it difficult. Because for him, he will ask you for evidence. He will always ask you for evidence. So you should have an evidence so that he can meet the district director and work on this. Thank you.
Thank you so much, Fam Daniel, for sharing that. And I'm sure what you have shared is going to be very useful and helpful to Stephen Banner. François?
No, I think Farm puts the hammer on the nail. I think Farm is very data-driven, and I am 100% data-driven. When you have a problem, the more data you have on the problem, the more you can convince your superior that something needs to be done. And the data will be the convincing argument, because we all need a better situation. We can say things, but when we come with baseline data and showing that there's a drop in attendance, and we know Ghana is doing very well in many areas, and you're in hospital, you may have a chance to succeed, as he says. So I suggest Stephen to really look at the data suggested by Farm and to bring it in your situation analysis to sell your cause and get a positive answer. So thank you, Farm, also for repointing the importance of a data-driven when you have a problem to really show evidence with data. Thank you.
Thank you so much, François. And one of the core IA2030 principles is actually that everything we do around Immunization Agenda 2030 needs to be data guided. So it is by design that for your situation analysis, everything you do has to be substantiated with data. And that is why you are even asked in the situation analysis to cite your data sources. So it's very important. And while you are improving upon your situation analysis, please do not forget to lay emphasis on that. So tomorrow we'll be having our technical support session. And if you're having any technical issues working on the final version of your situation analysis, go ahead, register and join tomorrow's session. But what the invitation I really want to insist on is for the Thursday's experience sharing session that will be focusing on 0 dose. So even if you don't have any experience around 0 dose, join us on Thursday. You heard whether lay emphasis on that, and our colleague Ian Jones also talked about it. I'm sharing the links and the information around that again with you in the chat. Please register and join us on Thursday for number one. It's going to be the last experience sharing session for this particular exercise of situation analysis, so you don't want to miss it. And then also it's going to be focusing on 0 dose. And even if that was not your challenge for this exercise, I am sure that all of us have a problem with 0 dose children, 0 dose communities, wherever we are and where we work. And it will be an opportunity for us to come and hear firsthand from others exactly what they are doing about that. And when for those who receive the survey, please respond to it as soon as possible. And I see Stephen is thanking Fam Daniel for his thoughts, and we'll be contacting you for support. So before we go, I always like to turn towards Dr. François Gasse for the parting words, what we'll need to take home after today's experience sharing session. Thank you, everyone, and thank you, François. Over.
Thank you, Charlotte, and thank you, all of you, to have shared your thoughts on the situation analysis. And, just to remind you that your situation analysis is to identify first a challenge, a very specific challenge amongst the many challenges you face to achieve an objective. and then dig into the cause. And from the cause, you have results. And from those results, if you have the root cause, you will be able to identify corrective measure that you will start fighting for implementation is the next step. But I think the key is to be extremely specific and avoid assumptions. You know, the more you put data behind a challenge or behind a cause, the more you become credible that is worth you spending your time and your effort and sometimes money, as we have heard, to invest in that challenge and its solution. Thank you and good luck.
Thank you very much, François. And I'm asking everyone to unmute.
Thank you very much.
Yeah,
Thank you very much.
Thank you, Charlotte.
Thank you. Thank you.
Thank you,
Thank you, Charlotte.
Bye.
Thanks.
Charlotte, you allow me to submit the final version.
Thank you. Thank you.
Bye.
Thank you.
Thank you. Bye.
Bye. Bye.
Thank you. Bye.